Let us have this meeting come to order. Good morning. This meeting has come to order. Good morning. Welcome to the Assembly Budget Subcommittee number 1 on Health and Human Services. Today, we will take a number of votes to close out items in the areas of health, areas that affect the Department of Developmental Services, and a number of other human service items. I'd like to just say thank you to the members of this committee for their great work, to all the stakeholders, to representatives from various departments, to all of our budget staff, to our policy staff, and all of the interested parties who've spoken on these issues. As you know, we've had many, many tough years in the last several years where we've seen dramatic cuts to health programs and to programs that serve seniors and foster youth and others in our social safety network. While it's difficult to not be able to restore every single program that has been impacted and all the programs we care about, I want to thank this committee and others for working together to put together a very broad recommendation of services and opportunities to help restore some of what has been cut over the last several years. After we take our actions today, we will then continue our work through the budget chair and the speaker and Senate leadership and ultimately through the governor. So there's much more work that has to be done, but we see today as a very important step and an important first step in helping to restore very important services to help the most vulnerable in our state in the areas of health and human services. With that, we'll get underway, and I would ask the clerk to please call the roll.
Thurman?
Here.
Thank you. Can you push the red one? Thurman?
Here.
Bonta?
Here.
Chu?
Here.
Grove? Here. Jones?
So we'll begin in the Department of Health, and there are a number of actions that we'll take. I'll ask the clerk to please call the first, to read the materials for the first action. It is the Office of Law Enforcement and Support.
The staff recommendation is to approve of the LAO alternative proposal, which includes approving of $600,000 and 4 attorney positions for the Office of Law Enforcement Services, denial of the proposed $600,000 reimbursement authority for the Office of Law Enforcement Support, transfer investigation resources that were requested for the Office of Law Enforcement Support to the Office of Inspector General, and adopt placeholder trailer bill to provide the Office of Inspector General authority over Department of State Hospitals and Department of Developmental Services per the details in the write-up on page 3 of the agenda.
Can I have a motion to that effect?
So moved.
Is there a second? Item's been, we have a motion and a second. Madam Clerk, please call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
That item is out. The next item is for the Office of Statewide Health Planning and Development. The clerk will read.
The staff recommendation is to approve of the elective percutaneous coronary intervention budget change proposal modified by making the position's 2-year limited term.
Can I have a motion? Is there a second?
Second.
Item has a motion and a second. The clerk will call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove? Jones?
That item is out. Moving on to the item for the Department of Managed Healthcare. The clerk will read.
Staff recommendation is to approve of the federal mental health parity budget change proposal as proposed.
Can I have a motion?
So moved. Second.
Motion's been moved and seconded. The clerk will call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
That item is out. Next item is the individual market reforms budget change proposal.
Staff recommendation is approval of the individual market reforms budget change proposal as proposed.
Can I have a motion?
So moved.
Is there a second?
Second.
There's a motion and a second. The clerk will call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
No.
Jones?
That motion passes. Next item, the large group claims data budget change proposal.
Staff recommendation is to approve of the large group claims data budget change proposal as proposed.
Do we have a motion?
So moved. Second.
It's been motioned and seconded. The clerk will call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
No.
Jones?
The motion is out. Next item, dental plans medical loss ratio budget change proposal.
So moved. Second.
Thank you. And can we have the language read for the motion?
Staff recommendation is approval of the dental plans medical loss ratio budget change proposal as proposed.
We have a motion by Member Chu and a second by Member Bonta. Please call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
That item is out. Moving on to the Department of Healthcare Services, we have a number of motions. The clerk will read.
Staff recommendation is to approve of the family health estimate, including may revise adjustments.
Can I have a motion?
So moved. Second.
It's been motioned and seconded. The clerk will please call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
That item is out. Moving on to behavioral health treatment budget bill language.
Staff recommendation is approval of placeholder budget bill language to allow for the transfer of funds from the Department of Developmental Services to the Department of Healthcare Services for children to receive behavioral health treatment through DHCS rather than through regional centers.
Can I have a motion?
So moved. Second.
We have a motion and second. The clerk will call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
That motion is out. On to the issue of the Doctors Medical Center closure.
Staff recommendation is to approve a one-time appropriation of $2 million general fund to the Department of Healthcare Services to be allocated to Lifelong Community Clinic to support extended hours for urgent care services and adopt placeholder trailer bill to implement this appropriation.
Do I have a motion?
So moved. Second.
Item's been moved and seconded. The clerk will call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
No.
Jones?
That item is out. Supplemental reporting language on suicide hotlines. The clerk will read.
Staff recommendation is to request supplemental reporting language from the Department of Healthcare Services regarding suicide hotlines as described on page 8 of the agenda.
Can I have a motion?
So moved.
Is there a second?
Second.
Item has been moved and seconded. Clerk will call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
That item is out. On to the Medi-Cal estimate.
Staff recommendation is to approve of the proposed Medi-Cal estimate, including adjustments in the may revise with any changes to conform as appropriate to other actions that have been or will be taken.
A motion.
So moved. Second.
It's been moved and seconded. Please call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Not voting.
Jones?
That item is out. County Eligibility Administration Annual COLA Trailer Bill.
Staff recommendation is to deny the proposed trailer bill to eliminate the annual COLA for County Medi-Cal Eligibility Administration and instead adopt placeholder trailer bill to suspend the COLA for the 2015-16 fiscal year.
Is there a motion?
So moved. Second.
It's been moved and seconded. Please call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
That item is out. Moving on to hepatitis C treatment funding may revise proposal.
Staff recommendation is to approve of the estimated costs for treatment of hepatitis C in the Medi-Cal program.
Can I have a motion?
So moved. Second.
It's moved and seconded. Please call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
Motion's approved. Next item is pediatric palliative care pilot program expansion.
Staff recommendation is to approve of the proposed expansion to the pediatric palliative care pilot program.
Is there a motion?
So moved. Second.
It's been moved and seconded. Please call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
That item is out. CHDP dental referral trailer bill.
Staff recommendation is to approve of the proposed placeholder trailer bill to update the recommendations on age-appropriate dental referrals in the Children's Health and Disability Program as proposed.
Is there a motion?
So moved. Second.
It's moved and seconded. Please call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
Aye.
Jones?
That item is out. Moving on to annual open enrollment proposal.
Staff recommendation is to deny the proposed trailer bill to create an annual open enrollment period in Medi-Cal managed care.
Is there a motion?
So moved. Second.
It's been moved and seconded. Please call the roll.
Thurman?
Aye.
Bonta?
Aye.
Chu?
Aye.
Grove?
No.
Jones?
That item is out. Moving on to limited scope programs trailer bill.
Staff recommendation is to approve of proposed placeholder trailer bill related to limited scope programs, modified by removing the provisions related to the genetically handicapped persons program.
Is there a motion?
So moved. Second.
It's moved and seconded. Call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Moving on to major risk medical insurance program trailer bill.
Staff recommendation is to deny the proposed trailer bill language related to eligibility for the major risk medical insurance program.
Is it managed?
Is there a motion?
So moved. Second.
It's moved and seconded.
Major.
Please call the roll.
Doesn't matter.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
No.
Jones.
That item is out. Next item is skilled nursing facilities quality assurance fee trailer bill.
Staff recommendation is to approve of the proposed placeholder trailer bill to reauthorize the skilled nursing facility quality assurance fee and also adopt placeholder trailer bill to require DHCS to include direct care staff retention in quality and accountability measures, and 2, require DHCS to report to the legislature on the quality and accountability payments.
Is there a motion?
So moved.
Second?
Second.
It's been moved and seconded. Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Next item is health home program trailer bill.
Staff recommendation is approval of the proposed placeholder trailer bill to implement the health home program.
Do I have a motion?
So moved. Second.
It's been motioned and seconded. Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Moving on to ground emergency medical transportation trailer bill.
Staff recommendation is approve of proposed placeholder trailer bill to implement this proposal to enhance federal funding for ground emergency medical transportation.
Is there a motion?
So moved. Second.
It's been moved and seconded. Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Next item, application assistance payments trailer bill.
Staff recommendation is to approve a proposed placeholder trailer bill to implement this proposal to redirect the balance of grant funds for application assisters to community-based organizations.
Is there a motion?
So moved. Second.
Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. The next item is healthcare reform budget change proposal.
Staff recommendation is approval of this budget change proposal as proposed.
Is there a motion?
So moved. Second.
It's moved and seconded. Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Moving on to healthcare reform financial budget change proposal.
Staff recommendation is approval of this budget change proposal as proposed.
Can I have a motion?
So moved. Second.
It's moved and seconded. Call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
No.
Jones.
That item is out. Moving on to palliative care managed care budget change proposal.
Staff recommendation is approval of the palliative care managed care budget change proposal as proposed.
So moved. Second.
Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
I'm sorry. Can we clarify? Is it palliative care?
Uh-huh.
Yes. Aye.
Jones.
That item is out. Moving on to performance outcome system budget change proposal. Is there a motion?
So moved. Second. Second.
Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Moving on to drug Medi-Cal workload budget change proposal.
Staff recommendation is to approve of the drug Medi-Cal workload budget change proposal as proposed.
Is there a motion?
So moved.
It's been
Second.
moved and seconded. Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Moving on to the substance use disorder treatment budget change proposal.
Staff recommendation is approval of the AB 2374 substance use disorder treatment budget change proposal as proposed.
Is there a motion?
So moved. Second.
Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Moving on to the Medi-Cal eligibility meds budget change proposal.
Staff recommendation is approval of the meds budget change proposal as proposed.
Is there a motion?
So moved. Second.
Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Moving on to the financial audits workload budget change proposal.
Staff recommends approval of the financial audit's workload budget change proposal as proposed.
Is there a motion?
So moved. Second.
It's moved and seconded. Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
Next item, issue 25, drug Medi-Cal waiver budget change proposal.
Staff recommends approval of this budget change proposal, though modified by reducing the number of positions from 13 to 6.
Is there a motion?
So moved. Second.
Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Next item, Medi-Cal provider rates.
Staff recommendation is to approve of the repeal of AB 97 rate cuts by implementing a 5% rate increase on April 1, 2016, and an additional 5% rate increase on April 1, 2017, assuming costs of $32.75 million general fund in 2015-16.
So moved. Second.
There's a motion and a second. Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
Next item, issue 27, optional benefits restoration.
Staff recommendation is to restore the following optional Medi-Cal benefits: acupuncture, audiology, incontinence creams and washes, optician, optical lab, podiatry, and speech therapy, assuming costs of $15 million general fund in 2015-16.
So moved. Second.
Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Next is caregiver resource centers.
Staff recommendation is to augment the budget for caregiver resource centers by $3.8 million general fund.
Is there a motion?
So moved.
Well, please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Aye.
Jones.
That item is out. Issue 29, the naloxone grant program.
Staff recommendation is to appropriate $2 million general fund to the Department of Healthcare Services to implement an naloxone community grant program and adopt placeholder trailer bill to implement this program and appropriation.
Is there a motion?
So moved. Second.
Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
Not voting.
Jones.
That item is out. Issue 30, the RFK Health Plan.
Staff recommendation is to appropriate $2.5 million one-time general fund to the Department of Healthcare Services to be allocated to the RFK Health Plan and adopt placeholder trailer bill to implement this appropriation.
So moved. Second.
It's got a motion and a second. Please call the roll.
Thurman.
Aye.
Bonta.
Aye.
Chu.
Aye.
Grove.
No.
Jones.
That